that we have planned for the day. So, ladies and gentlemen, when it comes to small children, we consider a lot concerning their health. If something like shaking, as we already term fit, yes, we consider a lot when it comes to small children. Febrile fits, febrile convulsions, there are many names and many misrepresentations of certain conditions. So, today we are going to clearly explain with some practical demonstrations how to manage those conditions and what those conditions are. So, to do the honors, we invited Dr. Ponyani Bandhutilaka, consultant pediatrician of the National Institute of Infectious Diseases. Thank you very much, madam, for joining with our discussion. Right. Okay. So, madam, when it comes to small children, we encounter many conditions. So, to expose today's topic, before exposing, can you just explain what a fit is? It's ordinary a shaking of the body, or what is it, madam?
Actually, Charita, a fit, what we mean by a fit is the child will, most of the time they will be unaware of the surrounding and they will lose their consciousness and the eyes will roll up and they will become stiff in the body and they will start shaking. So, that is called a generalized convulsion, not a generalized fit. But there are certain different types of fits where one side of the body, that means the upper hand and the lower limb, will shake only, or sometimes they will have fits but they are aware of the surrounding. So, likewise there are certain different types of fits, but today we are going to elaborate on febrile convulsions and make the people aware about febrile fits.
Right. Okay. So, madam, why is it important to discuss about these febrile fits?
Actually, febrile convulsions are convulsions of fits which will a fit which will happen with fever. So, these febrile fits are incredibly common among our little ones and they are very benign. But our parents, young parents, they don't know about this. So, when the parents or mother or the father, when they first time when they see their child fitting, they get really panic. They start shouting and some people fall down, they faint, and most of the time the person next door will bring the child to the hospital. So, when the child arrives in the hospital, we don't know what really has happened at home. So, therefore, it is very important that you all know as young parents what is a febrile fit, whether this is a very benign situation and what you should do during a fit and what should not be done as well. So, that is why we thought it is very important to elaborate on this subject.
Madam, a small addition, can you just explain the word benign?
Yeah, benign means it won't affect them in their future. I will explain it in detail in my discussion.
Right. Okay. So, madam, when you just explain, you just mentioned about a fever condition and just it proceed. So, when it comes to a fever condition of a small child, is it one of the most concernable things?
Yes, of course. The children of course get fever with some bacterial or viral or whatever infection. So, the child will get fever and that is a good thing because the child has started reacting to the bacteria or the virus and it will show as fever. So, fever is a good thing because our bodies has started fighting against the organism. So, fever is a good thing, but we have to find out why this child is getting fever and treat appropriately. But some children with their fever, they can get a fit.
Right. Okay, madam, how does this febrile fits happen or occur?
Yes, actually fits happen with fever. So, by definition, this happens in a child who is 6 months to 6 years old, in a small kid. With fever, they will get a fit. So, actually this fit will settle on its own. Usually this fit will last less than 5 minutes or 15 minutes, usually very short lasting. So that is the type of a febrile fit we are talking about, and this is quite common among small kids. And this fit happens not because of the temperature. That's what we have to understand. This happens because of the cytokines produced because of the infection. It produces cytokines like interleukin 1, which will cause the fit. So sometimes when the child gets the fit, the child may have fever, or just after the fit the child will develop fever. So sometimes the parents don't know that child is having fever till they develop the fit. So both types can occur in febrile convulsions.
That means, madam, fever first or fever
After the fit, both can happen.
So what is the difference, madam? Is it like internal, what do you call, a change?
It is because of the cytokines which are produced like interleukin 1, which will cause the fit in the brain. So the timing of fever, of course, it depends.
Right. Now with this discussion, if one is listening, if young parents are not aware about the occurrence of fever, now you know fever can occur before the fit or after the fit. Madam, when it comes to a doctor, as you mentioned previously with the example, parents must know what has happened because the doctor is not aware what has happened at home.
Yes.
In that case, occurrence of fever, is it before or after? Is it like one that we have to consider when it comes to the reporting to a doctor?
Actually, when you come to the hospital, when a fit happens, what we really have to do is we have to observe what is happening to the child, and at the same time you have to support the child. So when a fit happens, usually they lose their consciousness. That means the awareness about their surrounding they lose. That how you can find them is if you call them by name or whatever it is, they will not respond to you.
That means what this child was previously responding, he is not aware about such.
Yeah. So he will be having loss of consciousness, their eyes will roll up, sometimes they will pass poo and wee at the same time, and they will start shivering. Their body will become very stiff if you hold them, and they will start like this movements.
Right.
So it is very important to know whether when you come to the hospital, for us as physicians to know how long this fit was going on. So it is very important that you look at the clock. During when the fit starts, you look at the clock. Especially if it is going more than 5 minutes, we ask them to bring the child back to the hospital. And if it is less than 5 minutes and if the fit settles, bring the child after the fit. But if it is going on for more than 5 minutes, please bring them to the hospital. But we have to be very, very careful about positioning the baby during transporting.
Right. Okay. So we'll demonstrate that thing later on.
Yes.
Madam, you just mentioned, I'm just going into detail because when it comes to small children, young parents and even matured parents, they might consider a lot because sometimes the baby is their life and they love a lot with the affection, care that they are exercising, they consider a lot. So madam, just the fever condition again, fit is there, fever starts, then the fit comes, or later on the fever comes. So how long will the ordinary fever persist?
That of course is difficult to say. The fever can go on, it depending on their infection, whether this is a bacterial or viral. Sometimes it will settle with, if you give paracetamol, it will settle, come down, and then it will restart depending on the etiology.
Right.
So, but if it is a bacterial thing and if we hit the bug with some antibiotic, then the fever will settle.
Right. Okay. So that means the fever condition, it is difficult to say like the fever which is starting before the fit will end after the fit, or fever start after the fit will end somewhere around 1 to 2 hours. We can't say like that. So ma'am, just again one small addition. You just mentioned about this is not a condition related with temperature. But you said that madam, with symptoms and things, the child might be start shivering with the rolling of eyes and some other expressions. So in that case, what people and parents try to do is that when the child is shivering, they just quickly glance at the child and just consider this might be some just to go with some what we are doing for fever. Is it okay?
No, actually shivering is very different from a fit. Shivering is something like this. So, fit is very, the way they will become stiff and they will have very, very like movements like that. So, shivering is very different too. There are causes for shivering, but fits are different. So, managing the fever itself is not enough. If they get fever and a fit, they have to come to the hospital and seek medical advice.
Right. So, coming to the hospital, if the fit is there, like if it ends by somewhere around 5 minutes, after the fit, yes, you can transport the child to the hospital, bring your child to the nearest hospital. Or if the fit is continuing for more than 5 minutes, yes, within that time, you just need to come to the hospital. It does not say like there might be certain things when on your way to the hospital, child might be stopped the condition, but just concern a lot because medical advice is important in this condition. So, madam, when it comes to this febrile fits, and we have a demonstration also pending, we need to do. What types of febrile fits are there?
Actually, Charita, there are two types of febrile convulsions. So, first time, as I have explained to you, it's a simple febrile convulsion where the child will be in between 6 months and 6 years old. In a child with fever, they will develop a fit, but the fit will last only less than 15 minutes and only one fit will happen within the first 24 hours. Only one fit will happen and they will be quite all right. Once the fever settles, they will be very happy, running around and up and around, and they will eventually go home without any problem. We don't have to make much work up for these kids. Their fever will settle and they will go home. That is simple febrile convulsion. But there are certain children where they will not have the same. They will also get febrile fits. They are also children in between 6 months to 6 years, but within the first 24 hours they can have more than one fit. And their fit can go more than 15 minutes.
Right.
Or they can have fits after the first 24 hours. So, or they can shake only one side of the body, right side or the left side. So, those children we call it complex febrile convulsions or atypical febrile convulsion. There we have to be very careful whether this is due to some underlying pathology like a brain infection, like meningitis, encephalitis, or some brain bleed or something like that. We have to be careful. So, we will be doing some workup for these kids.
Right. So, madam, two types, simple and complex. So, in simple conditions, we will just specifically emphasize once again, within the first 24 hours, one fit. That means 1-2 shaking or just 2-3 minutes shaking, that's it.
Yeah, right. Less than 15 minutes
15 minutes shaking. Right. So, we mentioned about specifically that 5-minute time period when it comes to
15 minutes time period.
15 earlier transporting
to the hospital.
So, in simple conditions also, after the first 5 minutes, if it is not stopping, it is okay that like parents are not aware, they have to bring, right. So, in that complex condition, you mentioned about, madam, certain things they can only move one side of the body, and there are certain other consequences and like the fever thing, and you just explained. So, in that condition, definitely we have to bring it to the hospital.
Because they can the fit can go for more than 15 minutes, where we have to attend to the child, we have to treat the fit. And give something to stop the fit.
Right.
If the fit is going for more than 30 minutes, it can cause brain damage. So, that is why it is important if the fit is going for more than 5 minutes for them to bring to the hospital, because from home to the hospital also will take some time. So, that is why we advise them to bring the child to the hospital if the fit is going on for more than 5 minutes.
Right. Okay, so madam, when it comes to simple conditions, you said that after the fits and after the fever comes to a certain end, the child is very happy, he is active, and he is doing the normal proceedings. So in that type of a situation, are medical treatments essential, or just we can just stay at home if he is okay?
No. Usually, even if the fit happens less than 5 minutes, we will ask them to bring the child to the hospital. So, we can, one thing, we can educate the mother what to do and what not to do where during a fit, and also we have to find out why this child has got fever. Because now this child has got a fever with a fit, but the fever is due to some reason. So, it can be due to a throat infection like tonsillitis, or middle ear infection like we say otitis media, or it can be brain infection like meningitis, encephalitis, or maybe septicemia, infection which has spread to their blood circulatory system, or it can be a urine infection. So, and these days it can be dengue, COVID, influenza, all these things are possible for them to have a fever. So, we have to find out why he is having fever and we have to treat him.
Right. So, at the first instance, we have to, as physicians and as parents, we have to consider about why the person, why the small child is having this type of a fever, and to understand that situation, and even the most important thing, how to act in such a situation. You need some advices, because there might be generalized advices. You might be watching this program, you might know everything, but that is not. So, there are certain personalized conditions which is limited to the scope of your child. Just you must be practical with that, and you must get the proper education from a professional. So, bringing the child to the hospital is essential in that type of a condition. So, madam, when you just talked about certain conditions, sinusitis, ositis, and certain other infectious conditions which will lead to the fever, COVID or dengue or whatever it is. So, madam, is there any connection between that occurrence of fever, and people might think that, oh right, oh, my child got fever and COVID recently, is there any possibility of developing these febrile convulsions?
If they have fever only, they will develop a fit. So, without with the past infections, they can't develop fits. So, if they have fever, they can get a fit.
Right. Okay. Madam, then apart from these febrile convulsions, are there any specific reasons that people can, children can get?
Yeah, there are many reasons why children can get fits, especially with fever or without fever. If a child is having fever and a fit, apart from febrile convulsions, there are alarming things which need very essential and urgent medical attention. There are several causes, especially brain fever like meningitis and encephalitis. So, meningitis means bacterial infection of the meninges, or encephalitis, viral infection of the brain. So, though in those instances also child can get fever and a fit, but they are very different from children with febrile fits. They will have, they are very ill. They are very ill, clingy, crying all the time. They may be very drowsy, sleepy, and they will get lot of fits one after the other. They won't like the children with febrile convulsions, as I have told you. When the fever settles, the child with febrile fever will run around, they will be playing and all this and that. When another fever happens only, they will be bound to the bed and clingy to the mother. But the children with meningitis and encephalitis, they will always be very drowsy, sleepy, or crying all the time, ill looking, and they need quite quick medical attention, otherwise they will go into very disastrous complications.
Right. Can you just term some disastrous complications,
yes,
madam?
They can go into a situation we call as cerebral palsy, where they will be bed bound. Even though children who were running around can come into a situation, they will stop walking, stop talking, and they are like 3 months to 5 months children just on the bed lying. They can't do anything. So, they can develop cerebral palsy. they can have vision problems, they can have severe vision problems like they can go blind, they can have severe hearing problems, they will go deaf. So, their speech will be affected, their learning ability can be affected, some people will be totally bedbound and some can even die. The good thing about febrile convulsions, children will never die of that, but if they are having fever and fits due to meningitis and encephalitis, there are possibilities of death and severe debility.
Right. Okay. So, madam, what is essential is that within these conditions, to manage it at home,
Yeah.
parents must know what to be done
Yeah.
correctly,
Yeah.
accurately, safeguarding the health condition of the child, and become like make it more convenient for the physicians to conduct the rest after these types of conditions. So, we have set a small demonstration, a practical demonstration how you can handle your baby. So, this is very important because with professional advice you can train yourself, you can get to know about how to manage this type of a condition, because the positioning of the child when it comes to transporting immediately after a fit, briefly but elaboratively we are going to demonstrate that practical within a practical setup by our guest Dr. Punyani. So, madam, we'll just proceed with.
Yeah. So, when a child starts fitting, you all have to know what really you should do and what you should not do. So, when the child starts fitting, actually we have to turn the child to the left lateral position and keep the child very comfortably, and don't put anything inside the mouth, not allowing child to drink anything. You just support the child and look at the clock to see how many minutes the fit is going on. So, some parents tend to bath the child during the fit, and also some parents are tepid sponging. Actually, anything should not be done to make the child uncomfortable. So, don't do any of those things, just keep the child in the lateral position, don't put anything inside the mouth or don't give anything to the hand, just watch the clock how many minutes of it is going on. If it is going on for more than 5 minutes, you have to bring the child to the hospital, the nearest hospital. Actually, while you are transporting also, you have to keep the child like this, but you can't hold the child upright like this and transport. You have to bring the child like this to the hospital. It is very important. Why? During the fit, the phlegm can come out. So, if you hold the child upright, the phlegm can go into the respiratory pathway and they can get blocking of the respiratory pathway and they can even die. So, it is very important that we keep the child in the lateral position and bring to the hospital.
Right. Okay. So, madam, we demonstrated how the child should be positioned when the fit is occurring.
Yes.
And even within the period that we are going to transport, how we should position the child. So, madam, you mentioned about this left lateral position.
Yes.
So, with this demonstration, parents might not be much familiar. If we say like the right side of the body is like to the ground side, is in the position.
Yeah.
Right. Okay. So, now it's clear. You can just imagine what the right side of the baby that we demonstrated, because she was facing our side and back side towards the camera, but just understand that and consider the reason not to hold upright. Yes, phlegm comes out, we should make the baby comfortable the time period without making any type of disturbance to the child. So, madam, these types of fits can occur again? There's a possibility.
Yes, there is a possibility of occurring it again. Especially these febrile convulsions happen between 6 months to 6 years. So, within that age limit, there is a possibility of getting another fit, especially if the baby gets the first fit before 1 year. They have a 50% chance of getting another convulsion with a fever. So, there are high possibilities. If your child has got a fever and a fit, again they can get a fit with fever before 5 to 6 years.
Right. Okay. So there are certain things that then we have to consider with this time period.
Yeah.
So, madam, we just mentioned about like 6 months to 6 years a time period.
Yeah.
So apart from that time period, if a child is suffering from these febrile convulsions and these types of diseases that we discussed within this time period, after proper medication or something, just we'll move on to that on later on. After that time period, is there any effects after the 6 years?
Yes, actually, as I have told you earlier, febrile fits are very benign. That means they won't cause any long term problems to the baby. It won't affect their IQ or the learning ability, and they will have normal development. They will grow as normal children, and it won't affect them at all. Very rarely some children can get epilepsy in their later life, but they are the people who will get recurrent complex febrile convulsions, or children who have a very strong family history of epilepsy in their family circle. And the children with some developmental problems like neurological problems, cerebral palsy, those kids may develop epilepsy in their later life.
Right. So, madam, can we just briefly mention what epilepsy is for our audience?
Yes. Epilepsy is actually, epilepsy is convulsions, fits without fever, and it happens because of some disturbance in the brain.
Right.
So, that we diagnose by doing a EEG test, a brain test,
Right.
and we will start them on long term medication for like 2 to 3 years every day.
Right.
But whereas febrile convulsions, we don't give any long term medication.
Right. Okay. So it's clear if you have such a family history, and there are certain conditions that these types of disease conditions can develop, but not just from simple incidents, simple febrile convulsions that we have discussed today. So, madam, that means, if I may conclude this, so simple types of convulsions, other than these some types of complex ones, there would be consequence later on.
Yes, yes.
So, aren't there any, or there might be diminished signs of things?
There are no complications.
Right. Then after the 6 years, back to back questions. So,
yes.
after these convulsions and everything, so you said that there is no any impact to the child.
Yeah.
Are there any precautions that the child need to take after 6 years who have already have a history of febrile convulsions?
No precautions at all.
Right. Okay. So, then we'll move on to the treatments. How to treat a febrile convulsion,
Yes.
madam?
Actually, when the child happens to get a fit and a fever, all what you have to know is, at home you have to position the child well, not to allowing anything to drink and all, and observe how long the fit is going on, and if it is going more than 5 minutes, bring them to the hospital, or if it happens less than 5 minutes, then after the fit you bring them to the hospital. Then what we do in the hospital is, we will measure their temperature, and depending on their body weight, if the child is having temperature, we will give them paracetamol to control fever. What is really important is, some may give certain medications to control fever apart from paracetamol, like as you all know, diclofenac sodium, mefenamic acid, brufen and those things, because the people get very alarmed with these high fever spikes, they will get more fits. So, they tend to give these type of medication to control fits, which should not be done in kids, because this fever can be simply due to dengue fever. And if you have given such medication to control fever, the situation becomes much worse in dengue fever. They will start bleeding, their liver will go really bad, and it is very difficult for us to manage the dengue fever if you have given medications as I have told you. So, to control fever, actually we only advise to give them paracetamol to their body weight, according to their body weight, every 6 hours if there is only fever. So, it is very important that the mother will have a thermometer at home, learn how to do the temperatures at home. There are several types of thermometers in the pharmacy. There are digital ones which are very easy. We can go and they will quickly give the measurement, or you can use even a mercury thermometer where you have to keep it for 2 minutes under the underarm or somewhere, and then get the measurement. So, if the temperature is more than 99 Fahrenheit or 37 degrees Celsius, only we will give paracetamol. So, that is to control fever. Then if the fit is going on for more than 5 minutes, when they come to the hospital, we will treat them with medication. Either we will give them some buccal medication, or if we get through a cannula, we can give some medication from that also.
Right.
So, apart from that, it is very important that we have to find out why this child started having the fever, the cause, and treat that as well.
Right. Okay. So, madam, it was a brief but little bit of a lengthy description about these types of medications. So, what really matters is when it comes to certain medications, if parents and even elderly people, they are known with a certain tablet or a certain oral medication that can be taken, or rather any other application, they try to repeat it with same symptoms that we are occurring.
Yeah.
So, paracetamol we can just always have it over the counter,
Yeah.
and within these conditions, madam, you advise giving paracetamol according to the body weight is okay.
Yeah.
So, paracetamol once repeated with this condition, and if a person or rather young parents or any other parent, when their child is having these types of fits, give paracetamol to drop the fever down, and with some 2-3 doses of paracetamol it diminished, but with that 5 minute, less than 5 minute or some convulsions has already occurred, but we gave paracetamol just to manage fever, and less than 5 minutes the convulsions also stopped. Now the second dose of paracetamol, but the fever is getting reduced. When it comes to the hospital also, they will only give the third dose of paracetamol, so no need to take to the hospital. What is your advice, madam?
Actually, giving paracetamol and keeping the child at home is not safe. Because paracetamol also we should be given every 6 hours only if the fever is there. But if the child is getting recurrent fevers for several days, actually we have to find out whether there is some other, what is the site of infection. Is it viral fever, dengue, or I told you, is it COVID, influenza, is it meningitis or urine infection, or respiratory infection, whatever it is, and we have to treat them. Otherwise, the fever will go on and the child will become very toxic.
Right. So, I will tell you a small story. When you go in a vehicle, you are inside the vehicle, your eyes are closed, and you feel air coming in. There are 4 windows of the vehicle. You might not be aware which window is open, but air comes in. You know a window is open. So, to stop that thing, you have to close the window. It's like this. So, air comes in. So, it's not the treatment that we should employ for this air coming in. We have to close the proper window. The proper window, or the place where this what do you call this condition originate, is you can't conclude it at home. That's what doctor said, mentioned clearly, specifically emphasized that we have to find the root cause and how this fever is occurring. What is the condition dealing with? Is it a bacterial infection? Is it a viral infection or any other condition underlying? Yes, we have to find that thing. So, giving paracetamol and keeping the child at home is not safe at all. So, there might be certain conditions where your child needs further attention, further medical care, further investigations, further proceedings which have to be maintained and insisted on the child in order to protect his health. Because always remember, these types of conditions, yes, they might be not long lasting. After 6 years, no consequence might not be there, but doctor specifically mentioned, without not treating this patient, the small child properly in the proper onset, giving false medication, having those errors at the earlier stage will cause for severe disastrous situations regarding which child, just a small 6-year-old kid, it matters what you do at the onset as parents in order to proceed with the health, successful well-being, healthiness of a child. So madam, in that case we just explained the importance of giving that proper medication with proper care and attention,
Yes.
with proper advice is mandatory. So madam, are there any ways to prevent this condition?
Actually, when the child gets fever, we can give the appropriate dose of paracetamol and control the fever. But controlling fever won't stop the fit. If the child is going to get the fit, he will get it. So, but it is very helpful to give paracetamol and keep the temperature down and keep the child comfortable, so that sometimes we might be able to prevent the fit. And there are other ways to prevent a convulsion. So, if the child is getting recurrent fits, recurrent febrile fits, we can start them on diazepam prophylaxis, where we will give a small medication, half a tablet of diazepam, morning and evening for 48 hours, to start with the first dose of paracetamol. We have to control the fever with paracetamol. Apart from that, we will give also diazepam for 48 hours to prevent a fit. So, that we can give as preventive medication if the child is getting recurrent febrile fits.
Right. Okay. So diazepam, mefenamic acid, brufen, diclofenac, like many medications, you might be aware of certain names with the discussion, but that is for under medical advice and care. You might be knowing the names, but no over-the-counter purchasing of medicines and giving it to the children. Yes, madam.
Yes.
Right. So, madam, are there any, like, do we have long-term treatments in this scenario?
Actually, we usually don't give any long-term medications for febrile convulsions, because febrile convulsions are very short lasting and they are very harmless, and they will last for a very short time and they will stop after 5 years. So, why we should give medication and expose them to unnecessary side effects? So, usually febrile fits we don't give any medication long term.
Right. So, there are certain myths and certain beliefs among the people. There might be certain vaccinations for certain kinds of disease conditions. So, madam, for febrile fits, are there any sort of a vaccination?
Actually, no vaccination for febrile convulsions, but up to about 13 years, our children are undergoing immunization according to the expanded program of immunization. So, if a child gets fits, so if the child is getting a febrile convulsion, the 1-year vaccine, the 1-year JE vaccine for the fever.
Yes.
Yes. So, that vaccine we will give 1 year later. We don't give, if the child happens to have a fit before 1 year, we don't give the first year vaccine, JE vaccine, but we will give it 1 year later.
Right.
Because they can, it will tend to fit.
Right. Okay. So, that means there is a small change in the procedure of vaccination.
Immunization program.
Right. Okay. So, only the JE vaccine is shifted,
Yes.
other than that nothing.
Yes.
Right.
If the children are getting convulsions after the 2nd, 4th and 6th dose of DPT, we can give acellular pertussis vaccine.
Right. Okay. So, there
Those
are small,
two things only.
those two things only.
Others,
Yes.
otherwise, there is no contraindication to the normal EPI vaccine schedule, because the child has got a fit.
That
They
means,
have to continue the normal routine vaccines.
right. So, that means, madam, this is like just a simple disease
Yeah,
condition.
very simple thing.
So, no more extending treatments,
Yeah.
but the proper care that is exercised on proper time.
During the fit.
Right. So, madam, like people might think, the students, my parents might think that this is like a huge devastating thing. Less than 6-year child starts shivering and shaking, fever, rolling of the eyes might be. Why these types of things happening? Might be a small infection, as you have mentioned already, but no long lasting things. So, can you just justify that thing to the belief of the people,
Yeah.
the
So,
spectators?
all what I have to say is, this is really benign. So, you really don't have to panic when your child gets a fit. just observe how long it is going on. Actually, but if the child is getting blue and all, you have to immediately bring the child to the hospital. Otherwise, if the fit is lasting for more than 5 minutes, you bring the child to the hospital. Usually, when bringing the child to the hospital, don't bring them like this upright. It will cause aspirate in the phlegm, and it can cause death in the child. So, always bring the child
The
in the left lateral position and support the child during a fit.
Right. So, no more medications, but you control the fever as a home remedy. At the onset, we can have paracetamol according to the body weight. If you are not aware about that particular dose, yes, please get medical advice. Otherwise, you don't give that dose as well, because like controlling the fever is not the main thing here, because it might be, we should specifically find, as doctor mentioned, sometimes some medications given for fever that will contraindicate with some sort of other disease conditions. So, it will be very serious and very difficult for the physicians to manage that condition for your child. It's for the sake of your own child. There might be a lesser percentage of happening, but it's 100% for your child, because he or she might be the only child or one of the few children that you have. Yes, his or her life is very essential, important for you, other than anyone in the world. So, physicians exercise due care, due diligence to your small child, but what you have to do as parents is to manage that condition properly, adequately, and without causing no harm to the child. So, we explain basically what we have to do, what we are supposed to do, with brief and rather sometimes extending explanations other than our previous programs. Yes, for madam, in our previous episode we might not be concerning lot more, stressing the same fact again and again, but extending this program to a considerable time period and giving the practical demonstrations is to give the proper understanding, give what is to be done correctly on proper time. That's what we wanted. So thank you very much, madam. Dr. Punyani Bandutilaka, consultant pediatrician of the National Institute of Infectious Diseases, for joining with us to educate the general public. Thank you, madam. Right. Okay. So this is the end of this chapter for February 5th with iMed program. So stay tuned with iMed program. We have planned a small video clip to give you some nutritional benefits within this program. So after that video clip, you'll be having other programs as well. Do watch us the rest of the program. So enjoy the programs, get educated, learn what is given through iMed. So just focus to the video clip. All the very best, and we'll move on to the next episode in the next week. Thank you very much.